This is Dr. Amanda from StraightSmile Solutions. Today we're going to be talking about my latest blog, and if you would like to go check out the blog, you can go to straightsmilesolutions.com and click on Read Our Blog. And let me take you there. All right, so the topic for this blog is really talking about, I get this question probably a couple times a month, difference between comprehensive, limited, and phase one treatment. So let's start phase one versus the others for now. So phase one is basically, in a nutshell, it's treatment that's directed, or interceptive is another word for it, treatment that is directed more towards younger individuals. Usually these kids could be as young as like 5, maybe all the way up to age 9. It's not really an age-based thing. It's more based on what stage of dental and skeletal development they're in. So you could have a 10-year-old theoretically who was still in phase one treatment because they only had, you know, eight permanent teeth and mostly baby teeth, and they were still growing. Whereas you might have a 8 or 9-year-old who was in comprehensive treatment because most of their teeth were in. So basically the goal of interceptive or phase one treatment is to correct the bite and or do certain manipulations or position the jaw or expand the jaw in a certain way so that growth is more favorable, or that the jaws are the right size so the teeth will come in better. So for the most part, it usually involves growth and changing the pattern or direction of growth of the teeth. Okay, so like expansion or jaw development, like encouraging a lower jaw to grow, or restricting the growth of an upper jaw, or encouraging an upper jaw to grow, or something like that. Sometimes interceptive treatment might just be straightening the front teeth. Maybe one tooth is out there and is in traumatic occlusion, or one tooth is in crossbite, or something like that, right? It's not usually a cosmetic thing, although theoretically it could be. There's always some parents that come in and they just want cosmetics, but usually cosmetics is addressed later. Okay, so that's interceptive. That's easy. Okay, so let's now talk about the more difficult and I guess more controversial topic, which is limited versus comprehensive. So this is, and if you talk to different orthodontists, you're going to get a different opinion each time. So basically, I'm pretty much translating what the AAO says. So for me, limited treatment means got a lot of things going on. We might have bite issues. We might have growth issues. But for the most part, we're just choosing to focus on like one issue, which is cosmetic. So maybe a patient has all kind of issues going on, but she just wants to close a gap. Or maybe the patient has lots of things going on and she just wants to straighten her teeth, the front 4 teeth only, So that's limited, okay? So I would say most direct-to-consumer treatment is limited. 6-month smiles is limited because they're using round wires and they don't express torque. So you're not doing what you should do, but that's okay. It's not that it's wrong, as long as the patient's aware and they're making a choice and they understand their risks, benefits, and alternatives, and they're making a choice, okay? So that's limited. And there's different things of limited depending on the age of the patient. Are they a teenager? Are they a kid? So that's what that is there, okay? So everything else, if it's not phase one and it's not limited, then it's comprehensive. So comprehensive in little kids, comprehensive in teens, comprehensive in adults, okay? So sometimes it gets a little wishy-washy. Let's say, for example, you're putting braces on all the teeth. You're fixing the bite for the most part, but maybe the patient didn't wear their elastics, so the bite didn't get completely fixed. And there's still 3 millimeters of jet. Yes, it's still comprehensive, okay? What about an adult? I had this scenario. We're doing Invisalign comprehensive. We're doing all the teeth. We are fixing the bite, but we're unable to fix the cross bite on tooth number 2 and 31, just because it's not possible without jaw surgery. Sometimes you can't, okay? In adults, it's still comprehensive, all right? So that's just there's an occasional one-off, but for the most part, in comprehensive, you're taking lots of things into account. You're going to do your best to idealize the bite, the smile line, the gingival contour, the alignment of the teeth, the soft tissue aesthetics. It may or may not involve taking a cephalometric x-ray. It's a little bit of a gray area depending on, what you're trying to accomplish, cephalometric numbers, and stuff like that. So anyways, that's that. All right. Hopefully that makes a lot of sense. And, this will help you with, I guess, your billing as well. So, because obviously if you're billing limited, you're going to get less money than if you bill comprehensive. And it makes a difference. So you do need to take these things into account. Okay. And so, yes, white label aligners can totally be comprehensive. Totally. Especially it's a phase 1 case. Sorry, a class 1 malocclusion. No reason white label aligners cannot be comprehensive. You're moving all the teeth. Not all. Let me give you a one-off. Not all the softwares or digital design programs do comprehensive. Some only do the front 6 teeth or the front 8 teeth or premolars on forward. In that case, no, it would be limited, which is another reason to use the right software company. All right. In any case, hopefully that helps you. Don't forget to visit StraightSmileSolutions.com. We have tons of resources, lots of freebies. I think I have like 100 blogs in there. You can also visit our YouTube site. We've got several hundred videos and demonstration videos, and we're always posting new things. All right. Thanks so much. We'll talk to you soon.